Very good day to you, colleagues from across the world, and a warm welcome to each of you. I'm Dr. Mohammad Mukhtar, National Director of Malaria Control Program, Pakistan, and also Chair of the APMEN Vector Control Working Group. In my highly honored capacity as the Chair APMEN Vector Control Working Group, I want to thank all of you for joining our APMEN online vector data management course. And I'm pretty much sure that you will learn a lot, many new things during this vital course. This online course is another of the range of capacity strength initiative organized by APMEN in support of malaria elimination. APMEN stands for Asia Pacific Malaria Elimination Network. But our courses are as relevant in South America or Africa as they are in Asia. Welcome on board, all of you, wherever you are from. We are fortunate indeed, definitely we are very fortunate indeed to have as our course trainer someone who I firmly believe that he's a top world expert in the theory and the practical on vector surveillance, and that person is Professor Dr. Neil Lobo. Professor Neil is deeply involved in the vector control project across the world with the very deep experience supporting the National Malaria Control Program, and he has a wonderful way of sharing his experience. But before we introduce Dr. Neil in more formally, I'm going to hand over to our course moderator, Dr. Liu Barak, who is the co-chair of the APMEN Vector Control Working Group, and he will tell us about something, how this course, training course going to work. So over to Dr. Liu for further proceeding. And thank you very much, all of you, for joining.
Right, let me just find my notes here, if you don't mind. So thank you so much, Dr. Mukhtar, for those warm words of welcome. And may I echo what you said, a very good day to all of you good people listening in. It's a genuine pleasure to have you as part of this online training course. Absolutely wonderful. There's 1,676 of you that registered for your course. I'm not sure if some of you can see, but the numbers are still, it's several hundred, but they're climbing steadily. So we're expecting a very strong group of participants that are going to benefit from the training by Neil. But it's a pleasure to have all of you as part of this online training course. Please know that the sessions are all being recorded and it will be available on the APMEN website. If you want to go back to the lessons or share them with friends, just connect them with the APMEN link. So our course will be over 2 days, today and tomorrow, for about 2.5 hours per day, which includes a 10-minute comfort break midway, and then a short question and answer session at the end of the day. Please listen to this carefully. Certificates of attendance will be issued to all people who attend each of the 2 days for at least 90 minutes each day, based on computer system records of attendance. We can tell each individual how long that person was attending the course, how many minutes there was a break, so that collectively we can see how many minutes per day you listened in. And only for those who listened in for at least 90 minutes per day, we will then send a certificate of attendance. But please note that the certificate will be sent to the email address you provided during registration. During the training sessions each day, please feel free to post your questions and request for clarification. But we ask, please put them in the Q&A box, not the chat box. The chat box gets cluttered with, and please feel free to use the chat box, obviously, with messages to friends and saying hello. And if you pose questions in there, the questions tend to get lost. So if you have questions or requests for clarification, please put them in the Q&A box. Thank you for that. So I'm going to introduce Neil, who's going to lead us through this course. Professor Neil Lobo is with the University of Notre Dame in the USA, and also with the Malaria Elimination Initiative at University of California, San Francisco. His research and government support takes him to malaria endemic countries all over the world. I promise you, all over the world. His primary interest is to clarify how the various aspects of malaria transmission interact to better understand the root causes of persisting transmission, residual transmission, and to improve our protection on a granular local level. I should also mention that Neil is the person who developed the very comprehensive entomological surveillance planning tool known by many as the ESPT. And that particular tool is now being used in many countries around the world. I'm hoping Neil will make reference to that ESPT because there is an electronic version, online version, ESPT, and we can put that up on the screen so you know where you can access that extremely valuable, highly effective entomological surveillance planning tool. Before we start, I'm going to ask you a very big favor. Please bear with us. I'd like to ask you a help, and that is to measure the increase in your knowledge over the duration of the course. We would like to ask if each of you could do a short vector surveillance knowledge test at the start, now, a few minutes time, and then also at the end of the course, tomorrow afternoon. You're not going to fail if you score poorly, don't worry. And your score will not be open for others to see. So it's a, you know, uh, private scoring. Please may we ask your patients to fill in this online questionnaire. I'm going to ask our colleague Wulan to explain how to access this online questionnaire and how to fill it in. You'll have 15 minutes, 1-5, and then after that, we'll start the course. As soon as you're done with the questionnaire in 15 minutes time, then Neil will start the course. Please don't use Google or search for an answer while you're doing the questionnaire. That doesn't help us understand how effective this training course is to improve your knowledge. We need to know your real knowledge. So please just use your own brain, not Google. So Wulan, may I ask if you can come in and explain to us how to access that uh, questionnaire, please?
Sure. Thanks, Leo, for um, all the introduction. So, can you hear me well?
Very clear. Thank you, Wulan.
Yeah.
Yeah. So, we're going to have 15 minutes pre-test. So, I put the link on the chat box. Then, so it's very straightforward. Please use your email address. So, make sure that you use the same email address for pre-test and post-test so that it's easier for us to track and compare the result between pre-test and post-test. So I would really appreciate if participants can try to hold not putting any message in the chat box so that the link here can be seen by others. So I pass the link here, I copy the link here, and yeah, please try to complete the pretest. Start from now. 15 minutes for you. Thank you.
So yeah, copy that link, put it into Google, and then enter the questionnaire. Thank you so much. Thank you, Wulan. So we're going to keep quiet for 15 minutes, and then as soon as that is done, then we'll get Neil to teach us, train us, and enlighten us. Thank
Sure.
you, everyone.
Yeah. We start on 1:10 p.m. Bangkok time. So until the next 15 minutes. Thank you. Just
Yes.
click the link.
All right, everyone. Thank you so much for your patience. We know you'd like the course to start, and we're going to do so in a few seconds. So thank you, everyone, for um, your patience in filling in this questionnaire. It's going to help us get an idea of your improvement in general knowledge about data management from now and until the end of the course after Neil is finished. So we're going to start now. There are going to be two lecture sessions this afternoon. Each session will be about 45 minutes long, and then we'll have a 10-minute break. And then after the follow-up 45-minute session, we'll have Q&A, question and answer session. So over to you, Neil, please.
Sure. Hey everyone, I'm Neil, and so I hope you find this useful. I actually have like 6 presentations or modules, so you'll have to be patient with me while I switch between each one of them. And I should do 3 today and 3 tomorrow. So I'll start by sharing my screen, and I hope you can see this. Where's the presentation mode? Yes, there we go. So this course is on designing entomological data systems for malaria control, as I'm sure you know, and hosted by APMEN and Malaria Consortium. Uh, so we'll start off. There we go. So these are the 6 modules we have. The first one is on why our data systems, why our entomological data systems actually are important and why they matter. The second one is on what data we actually need. And this is based on the decisions the program might have to make. And then once we figure out our decisions and the questions we want to answer, how do we develop that into a surveillance system to get the data that we need? Then we will look at data quality and how to manage it. And then once we have that data, how do we convert that data into information that we can actually use? So how do we interpret that data and integrate it with other data sets? And now that we have our analyzed data, how do we convert that into action? How do we actually use this entire systemic approach to collecting data into transforming what we do on the ground? How do we make a change with malaria? So we'll start off with why entomological data systems actually matter. And if most of you are entomologists, I'm pretty sure you know why.
Neil, just so you're aware, you're stuck.
I'm forgetting now, 2000 to 2015. And on the right is the same countries, and you can see the amount of malaria has gone down in those years.
Neil, can I just interrupt? We
Yes.
lost you there for about 30 to 40 seconds.
Oh
So
no.
maybe just backtrack for about 30 seconds.
Oh, of course. So the first presentation is on why entomological data systems matter. And entomological data systems matter because vector control works. And this is demonstrated in the graph on the right, where in this column over here, we have all these countries, and the same countries are on the right. And you can see the amount malaria has dropped in these countries over the space of 15 years. This is a modeling paper, and you can see the paper down here. You can reference it. And these vector control interventions resulted in about 68% of these cases going down. So vector control works, and that is why what we do with vector control and all our decision systems and data is really important. So why do they matter? So malaria transmission is, of course, driven by vector behaviors, by vector and vector behaviors. And this enables us to understand which, where, how, and also how they interact. So, which mosquitoes are actually vectors? Where are they? How they interact with humans, and how they interact with interventions, because both those are really important, right? And if you look at the little picture on on the right, the a Venn diagram, you could see humans on the left, vectors on the right, and the interventions on top. And where they intersect, all three of them intersect, is where we have protection. And where only two of them intersect, where the human behaviors and vector behaviors intersect, is where we have gaps in protection. And that is where every single one of our malaria cases come from. And that's what we need to understand. We need to understand how we protect people, but more importantly, how we are not protecting people, because that is where every single case comes from. And our data systems, our Ento data systems, enable us to understand this. Without entomological data, malaria programs are seriously, and I'm being honest, they are operating blind, because data enables us to understand where these transmission events are occurring and what we can do about it. So with our entomological data, we can look at the drivers of transmission, where it's coming from, what's supporting transmission. We can figure out which interventions will work best, and where they will work best. We can evaluate our interventions. And once we implement them with monitoring and evaluation,
Neil, are you there?
and optimal use of core WHO recommended interventions.
Neil, just to interrupt you again, we lost you again there for about 30 to 40 seconds.
Oh,
Not asking you to go back, but just making you aware that you're cutting out for
I'm
significant
sorry.
periods. No
Oh,
problem.
yeah, that's not good. I don't know why, because I'm sorry. I hope it is not a problem. Um, so if you look, I hope you read this slide. Uh, and I was just going over what residual malaria transmission is. It's ongoing transmission, even though we have good vector control interventions in place. So malaria control is fundamentally a decision-making process. It's how do we make decisions to optimally move forward. So national malaria programs must continuously make decisions, and these are
Please be patient with us. We're still waiting for. Okay, so we're waiting for Neil to come back again. Hi, Neil. You're on mute. Neil, you're on mute. Yes, we can see your screen. If you can go full screen.
hello everyone. I'm sorry about what's happening. I honestly don't know. I'm supposed to have good internet connection. Apologies. So I was meant saying that malaria control is fundamentally a series of decisions, and this enables us to function best in our country, at our sites, to protect our people the best we can. And these decisions need to be driven by data, and our data is obtained and processed by our Ento data systems. So just to look at interventions, when we look at malaria control, that's really when we're looking at intervention-based decisions, we can look at where to deploy bed nets, in which areas IRS might function best, where larval source management might function, and the new intervention that's been conditionally recommended, spatial emanators. We can look at insecticide resistance management and where to prioritize surveillance strategies, right? So better data leads to better decisions, and better decisions lead to more effective malaria control. And that's what we all want. So start off with good data, and we'll protect people better. And as an example of a question, and this is a graph from a paper that is not published yet, and all the data was obtained and analyzed by Ali Omar from Zanzibar, from the Zanzibar Malaria Elimination Program. We've submitted this paper, and he did this all himself. So he wanted to figure out what do we do in Pemba, which is an island off the coast of Tanzania, because they had high bed net coverage, but they still had persistent malaria. And he wanted to understand, what do we do? And he used entomology data, epidemiology data, as well as other metadata, and combining these together in a really good and efficient data system, he managed to explain why they had continuous transmission there. And in the figure on the right, which is not published yet, so please don't screenshot it, you can see this is sort of a summary of what happens at the site. He found out and he analyzed the data appropriately to explain that most of the transmission events, most of the exposure is happening in the orange, and that is outdoors. So, based on what humans were doing, based on the season, based on what mosquitoes are doing, and based on where malaria cases were actually being reported, so he combined epi and ento, he realized that most of the transmission was outdoors, while most of the interventions, which are bed nets, were indoors. And I can go over this graph again at a later point. I will reference this unpublished paper again. So data needs to be for decisions, not for reporting. I've no idea how many times people are so focused on generating the report that I collected all this data. Let me list it all out. We collected 500 mosquitoes from 50 sites or 5,000 mosquitoes. Instead, what should happen is we need to collect our data to inform decisions, right? It's a completely different approach. So poor surveillance systems that are not that great often, and I know this is true of people, and many people are sort of forced to do this, is to collect too many things. We collect too much data. Every single data point we can collect, we try and collect. We are not sure why we're collecting it. It isn't towards a clear objective. We generate data that is never analyzed. I have no idea how much data I have on my computer that no one has ever looked at and will never be used. Or data that doesn't reach decision makers, right? People who actually procure insecticides or decide which intervention to use or who to target. If the data doesn't reach them, it's of no point, right? And if we prioritize reporting over action, it's not that good. Really, it's really not good. So the key principle here is to only collect data that changes decisions, that can impact decisions, how we protect people. So again, large amounts of data are not used to impact decisions, and the purpose of data is to support decisions that improve control. And here's just two examples of questions or decisions and how they might improve control. Let's say we want to understand, should we continue, change, or replace the present intervention strategy we have in place, right? So our question would be, is our current strategy working, or is it plateauing in efficacy, or has it dropped in efficacy? And our data objectives would be, perhaps, depending on where we are and what we're doing, it would be to look at vector densities, human exposure, and associate that with malaria incidence. Another example would be, should we or should we not implement IRS, right? And IRS functions based on indoor resting mosquitoes. If your mosquito rests on walls, your IRS is going to be effective, right? And so our question is, what are the mosquito behaviors in this area that we want to target? And our data objectives would be to characterize mosquito bionomic traits. And the main ones would be, do they rest on walls that we can spray? And are they insecticide susceptible to the insecticide we want to spray? So sort of framing all the data we gather in terms of what the decision might be. And that could be, should we continue or replace our strategy, or implement or not implement IRS? And these are just two examples. So this is the last slide for this quick module. And I just want you to imagine this, put yourself in this position, right? Imagine that your country, wherever you are, has a newly elected government. I'm completely making this up. And they want to completely redesign the national malaria control program, right? Because malaria is still around. It's either high or it's low, and you want to go towards elimination, but malaria is still around. And you have been appointed the lead for malaria surveillance and control. And so throughout the next 2 days, I want you to imagine that you are in charge of everything. And so think about it from this way. You can make any decision you want. And before choosing your interventions or figuring out where to move your money or even working on your NSP, your National Strategic Plan, right? You want to understand what data, what information do you actually need to best make these decisions, right? So what epidemiological data matters? What entomological data do you need? How would you collect it? How would you structure it? How would you store it? How would you change this data into information? How would you interpret it? And then how would you use it for decisions? So start off with decisions, right? What decisions do you need to make? And then loop back into what data do you need? What questions are you going to ask? So for the next 2 days, I would like you to be in charge of your malaria surveillance and control program. So I hope you can do that. And that is a quick first presentation before I go into the second. Uh, can you see my slides? I hope that's okay. Yeah. So now remember, you're in charge of everything, and now you are going to build everything starting from scratch. So the first thing is, what data do you actually need? Right on the right, I have listed out just 1 to 8, a couple of entomological endpoints that you can measure. But then what data do you actually need? Right? So you start off with the question, right? What decisions need to be made? I'll probably going to be really repetitive with this. Start off with your decisions, right? Who will use this information, and how will this information, how will it influence or impact malaria control? How will it change things, right? And again, I see this a lot where people always say, what can we collect? What data can we collect? We can look at human biting rates, indoor resting rates, versus starting off with what decision we're trying to make. What are we trying to impact, right? Or we could be asking, what intervention should be primarily used at this site? And that's a completely different approach to what are the biting rates at our site, right? We start off with the decision we want to make. So different questions, and this is super important, different decisions have different questions, and they require different kinds of data. And on the right, we have a couple of questions, and those are, where is transmission occurring? Why is transmission occurring? Which intervention should we use? And this could be bed nets or IRS, LSM, or larviciding, or spatial laminators, right? Or is our intervention even working? Can it be optimized? And each one of those questions require a completely different data set, data system, and completely different, right? And if you do that appropriately, that will lead to better decisions. And on the left, again, we see not all malaria not all malaria problems require the same system. The decision will drive what data is collected, where you collect the data, when you collect the data, how often you collect the data, and how you analyze the data. Everything is driven by that, and everything is different. So when you think about your malaria program, and you have multiple decisions and multiple questions, how do you stratify? How do you organize all the data that goes into this data system to enable appropriate collection and analysis and decision making? That's what you're in charge of. That's what you need to decide. So what data do you actually need? Your surveillance starts with decisions, and your decisions and your questions will tell you which indicators you need to collect. Which indicators are your data endpoints, such as indoor biting rate, outdoor biting rates, and that will tell you what methods to use. And if any one of y'all have been on the other APMEN training course, which looks at entomological surveillance, you will get how your question will decide your indicator. Your indicator will tell you which method to use. Your method will tell you how to organize your entire data surveillance structure, and so on. So your data and analysis gives you information that results in action. And this is the sort of flow through. Your question or your decision tells you which indicators, which you can collect your data. Data is transformed into information, and I can go over that in a later module. And your information allows you to conduct appropriate action to change, to be able to do things that can change malaria control for the better. So what data do you actually need? There are tons of different kinds of data. Right in the middle, we have entomological surveillance data, and there's epidemiological data, and those are the two main kinds of data people usually look at, and we will be looking at as well. But there are also a lot of other kinds of data. Human behavior, which I feel is really important. What vector control interventions are there, and specific vector control interventions? That is important. Rainfall and climate is other important metadata. ACTs, whether they've been stocked out. Sorry about this little S on the next line there. So there are all these different kinds of data, and your question or your decision will tell you what kind of data to collect. So if we look at entomological data specifically, there is no single entomological data set or entomological data type that will answer every malaria control question. You have to figure out which sets of data you need to answer your question to make your decision. Different decisions need different entomological data, right? So a key difference between epidemiological and entomological data is that epi data will tell us where and how much malaria we have, and that's kind of obvious. But ento data, and this is what's important, will tell you why the transmission is happening and what can be done about it. And why transmission is happening is where humans and the mosquitoes overlap, why they overlap, when they overlap, and what can be done about it will tell us what interventions we can use, what is appropriate for that site, and appropriate for that location, appropriate for those specific humans. So now we look at how epidemiological data and entomological data can function where, right? With both of them, we can understand where and how much malaria there is, and the ento data will tell us why it's happening and what we can do. And once we do something about it, the epi data will tell us if we had an impact. So they sort of work together. If you look on the right, you have your question or your decision. You collect your data, you obtain your information, and you have a decision to make. And your question is based on the decision. So your first point is based on your last point. So some of you all might have seen this slide before. And by the way, on the right, top right, I have your question, data, information, decision, just to remind you to think about that sort of framework, that entire system functioning as we move forward. So we have many indicators or data points that we can collect. And here is an example of some of them. I don't think there are that many because a lot of countries collect a lot more data. So I would suggest to collect minimal essential indicators. At present, you know, I know, we all know there's not enough funding to go around. Funding has been slashed everywhere. So, what data points do we collect? We want to focus our efforts, our capacity, our infrastructure on the minimal amount of data that answers our question, that helps us make a decision. And so, just as an example, if we have IRS and we're trying to figure out, will IRS work at us at this site in our district? We don't have to collect all this data. The question is, how does IRS work? IRS works on indoor resting and insecticide susceptible mosquitoes, susceptible to the insecticide we want to spray. So the core set of indicators we would want to collect is just those two: resting location, are my mosquitoes resting indoors, and are they susceptible to the insecticide I want to spray? And if you organize your data system well enough, your data surveillance well enough, you can collect a bunch more indicators that help you understand when to implement your IRS. For example, seasonality will tell us we want when exactly to implement IRS. If we're looking at bed nets, the core set of indicators we want to do, the minimal essential set of indicators we would want to implement are these: just where and when they're biting, as well as insecticide resistance. And if we design our structures well enough, we can collect those as well. It's the same for larval control, right? If we want to do larval control, the primary data point we want to get is just that one: habitat occupancy. And if we design our systems well enough, bam, we can get a bunch more data that enable us to understand when, where, how to better implement these interventions. One thing we often forget, and this is so important, is that when we implement an intervention or when we do something, we change transmission. And if we change transmission, why do we continue doing the same surveillance? Why do we continue asking the same questions and collecting the same data? We shouldn't. We need to adapt and change what we do to look for these changes in the system. And the three things that can happen entomologically are changes in species composition. So imagine we have bed nets, and bed nets impact indoor uh, resting mosquitoes. No, sorry, indoor biting mosquitoes. I'm confusing myself here. They impact indoor late night feeding mosquitoes. And those mosquitoes will be most impacted by the bed nets, which means you might kill off a bunch of them. So your species compositions could change. And the ones that feed outdoors, the species that feed outdoors, and early in the evening would survive better. So those populations would remain the same, while the indoor ones would go down. So we have changes in species composition. We have changes in behavior. For example, those indoor biting ones now might start biting outdoors more because the ones that go indoors get killed off. And the third one is insecticide resistance, what we actually look at a lot. Programs look at this a lot. I only hope it goes into decision making, but we often look at it, even though all three are really important to look at and monitor. So this is something we need to factor into our thinking and the decisions we actually make. So I'm going to go over a couple of entomological data questions and decisions, and I've sort of framed it in terms of the decision, what data we would need, and why, just to go over the explanations. And there are just a couple of slides on various questions, and I hope these will enable you to sort of ask your own questions and frame the data you need, why you need it, towards the decision you have to make. So this first example is, which interventions are likely to be effective at my site? So based on the intervention, right, we'd want to look at the mode of action of that intervention. Your mode of action of the intervention overlaps with your species behavior, right? The species, your vector species at your site, each vector species has different behaviors. So you'd want to understand your species compositions, right? Oh, wait, my question is, which mosquitoes are transmitting malaria? I just went forward a slide or two. I apologize. So which interventions are likely to be effective? we'd want to look at which mosquitoes actually transmitting malaria at that site, because each mosquito species would have different behaviors, and those behaviors would interact with my intervention differently. So towards that, we would look at the species composition, the relative abundance, and of course, if you have the capacity, you can do molecular identification. I just added that in there because I do that a lot. But you'd want to look at your species compositions, the relative abundance. And from that, we would understand which vector species are there, and if you know how they behave. For example, Anopheles fenestus likes to bite indoors. Anopheles arabiensis stereotypically bites outdoors, though they can change based on site. So if we have Anopheles fenestus, we know an indoor intervention might work better. If we have Anopheles arabiensis, we know an outdoor intervention might work better. I have Anopheles gambiae SS listed out there because Anopheles gambiae SS bites indoors and outdoors, but usually prefers biting indoors. Though now, as I mentioned earlier, with long-term bed net usage, they have started biting outdoors more. So imagine two sites with the same amount of malaria. One site has either Anopheles gambiae or Anopheles fenestus, and the other site has Anopheles arabiensis. The first site with Gambia Arabian or Phonestis has a lot of indoor-biting, and that's where transmission occurs. And then the second site with the Arabiensis might have more outdoor biting. So you can imagine, even if they have the same amount of malaria, you would want to put in different interventions into each site because each intervention would function differently. So if we're trying to figure out which intervention is best to use at our site, we would want to start off with what species are there, what are their behaviors, and how those might interact with that specific intervention we are trying to evaluate. I hope that made sense. The next question that we can go over quickly is, where are people being exposed to malaria, right? And so the decision we are trying to look at all the way on the right is, are existing indoor interventions sufficient? Right? We could also use the decision of, should I put another intervention into place, a supplemental intervention, such as spatial laminators? And towards understanding that, the data we would need would be, where and when are mosquitoes biting? Are they biting indoors or outdoors? Where are humans? Are humans indoors and outdoors? And it's really important to me to look at human behavior, because if a human is not in the space where the mosquito is, it doesn't matter what the mosquito is doing because there's no human for him to bite. So if there's a lot of outdoor biting mosquitoes and all the humans are indoors, those mosquitoes are not going to give anyone malaria, right? So understanding where humans are and where mosquitoes are at the same time, because that's where transmission events occur, is important. So when we look at our decision and we look at the mosquito behaviors as well as human behaviors, we can understand the overlap between the two, this in terms of space and time. And as I mentioned, exposure, I didn't mention. Why is because exposure depends on mosquito behavior and human behavior. We need both those. And from that, we can understand how our intervention will work in those spaces and what other intervention we may need. So let's say we have our interventions in place and we still have a bunch of malaria. Our decision or question would be, how do we adapt to this? I want to adapt my program to increase protections. So we probably want to understand where and when people are being exposed, residual transmission, and the behavioral mismatches. And I mean the behavioral mismatch between humans and where humans and vectors overlap, and interventions. If you remember the Venn diagram of humans, mosquitoes, and interventions, we want to understand the gaps in protection there. And towards that, we would collect our species compositions, their behaviors. We'd collect resting behavior if we were evaluating IRS, human behaviors as in where and when they are, and of course, insecticide resistance. So if you want to understand how our program should adapt to present interventions, how to increase protections, we would collect this data. So here's a simple question. I'm pretty sure most of you have already worked on this. Are vectors resistant to the insecticides we have on our interventions? And the decision is, should I change my insecticide? Should I change my IRS? Or should I change my bed nets, right? And the reason is because resistance reduces intervention effectiveness. And then we can conduct WHO or CDC insecticide resistance assays, and if you have the funds, if you have the capacity, molecular resistance marker. Either way, your WHO or CDC assays will give you phenotypic resistance, and you'll understand, are my mosquitoes susceptible or resistance? And you can make the decision to change insecticides or not, or you could keep those insecticides if they are susceptible. Where are mosquitoes breeding? And this is directed at larval source management or larviciding. Larval source management incorporates larviciding. Larviciding is part of larval source management. Larviciding is a short-term strategy because you have to keep reapplying larvicide, and larval source management, where you take away the larval sites, where you fill them up, where you drain them, is a longer-term solution. So larviciding, it's important to realize that larviciding is part of larval source management. And so when you say larviciding or when you describe larval source management, point out exactly what you mean, because it could mean different things. It could mean you're changing the habitats, or you could mean you're going every 2 weeks to apply larviciding. And they are completely different strategies in terms of capacity, infrastructure, and how you would actually implement it on the ground. So should we conduct larviciding at our site? And here it's pretty simple. We want to identify productive larval sites so that we can treat them or remove them, depending on if we're looking at larval source management or larviciding. And we would look at the data we would need is, first of all, look at all the habitats out there and which ones are more productive. And we can do environmental mapping as well to understand which types of habitats are being used more by anopheles. So you can see if we understand that, we can decide if larviciding is feasible, if we can actually do it. If there are too many, it might not be possible, right? If it's rice field cultivation and there are millions and millions of mosquitoes, we might have to look at another strategy. So, or larval source management might actually be the best strategy for that site. So that's another question we looked at. I think this is the last one for entomological questions. Uh, Here's an example with bed nets. Bed nets are plateauing in efficacy. We're not getting any more protections, and people still have malaria. What should we do? The decision is, should we continue with bed nets? Should we modify or optimize bed nets? Should we add in another intervention? Because we're not getting any more reductions in transmission. Um, we want to see if transmission has changed, if there are any drivers that have changed. For example, species compositions might have changed, behaviors might have changed, or insecticide resistance might have changed, right? We want to see if there are any differences happening at the site that have resulted in bed nets not functioning as well as we would want them to. And we would look at
Uh, Apologies for these breaks. I know Neil is always very diligent about finding good sites, but clearly he's having a problem. Let's just give him a few minutes. Okay, Neil's back. Very good. You're on mute, Neil.
Yeah, I am sorry about this. I have no idea what's happening. I will try to do something for tomorrow. Uh, Now, I have no idea where I cut off at. I will share my slides, but I have no idea where I cut off. I'm sorry.
It wasn't a long pause, Neil, so about
Okay.
30 seconds or so.
Okay. I apologize to everyone. I will try and do something for tomorrow. So I think we were at is the intervention working? Bed nets. So went over the data we would need, why we would need it, and how it would change decisions. So you can imagine two options, right? One of them that says your three options actually. One of them where you find out that mosquitoes populations have changed, where now your mosquitoes are biting outdoors and they're only outdoor biting species, and all your indoor biting ones have crashed because your bed nets are working really well. So now you know bed nets are working really well. You might need a supplemental intervention to look at your mosquitoes that bite outdoors. If your behaviors have changed, it's the same thing, right? So a similar thing. So your mosquitoes are now biting outdoors more and less indoors. What do we do about those outdoor biting? And if you have insecticide resistance that's developed, you might want to change your active ingredient, your insecticide on the bed net. So a simple change in bed nets, I shouldn't say a simple change because it's never simple. Changing your bed nets to a dual active bed net or something like that might actually increase protections. So what is your decision? Why do you collect the data and what data you would need? Uh, so if transmission is changing, let's say your epidemiological data says that malaria is going up drastically or strangely, and how would you respond? You don't know what's happening, right? And transmission systems, we are looking at evolution here, and evolution is constantly trying to win. Malaria has been around longer than humans have been around, so they are they are pretty hard to fight. So transmission systems are always changing. The vectors change, humans change, interventions change, land use change, weather patterns change, everything changes. So our entire transmission system is dynamic. So based on all these changes that might happen, how do you incorporate this into an entire data collection system to look at this over time so we can appropriately respond? And the data we might need for this is longitudinal surveillance over time. And this doesn't just include entomological surveillance, also epidemiological surveillance. So we can tie the two together. We can look at species compositions and the trends of each species, biting behavior. So we can look at changes in composition as well as changes in behaviors, resistance monitoring, you know why, and human behavior trends, like are humans changing their behaviors? And this is interesting. What we found is based on the season, for example, in Panama, and that's an example I'll go into. In Panama, people changed their behaviors a huge amount based on the season. When it was rainy, they were indoors. When it was really hot, they were also indoors. When it was super nice, they were outdoors. And if you think about it that way, it makes total sense. But where they were changed their exposure profiles, right? Imagine our temperature going up with climate change. People might want to be in different locations, right? Based on that. So human behavior trends also change. So if you design your entomological data system well enough, you can actually understand over time how transmission is changing and how to respond to it. So so entomological surveillance is not about collecting mosquitoes, right? It's we collect mosquitoes, but it's about generating information to understand transmission, select interventions, evaluate the impact of these interventions. More, very importantly to me, is identify the gaps in protection, where transmission is coming from, and from the data, adapt our malaria control strategies. If you notice that all these 5 points are sequential and they function off each other, once we understand transmission, we can select appropriate interventions, we can then evaluate them. And when we evaluate them, we can understand where continued malaria is coming from, and then we can adapt our control strategies. And all this can be done with a really well designed data system. So again, the decision or the question determines the data you need. And interestingly, as an entomologist, people might hate me. Entomology systems need to rely on epidemiological data systems. Epidemiology is really important and we can't forget it. And I am going to now go into a couple of entomology examples about entomological data. And what I'm asking you to do is while we're talking about epidemiology, think about what you might need from your entomological system, right? So a epi and ento system need to function together. So when we're looking at these epidemiological data sets, uh, think about what ento will help support it, or how the epi data set will support your ento data set. And I have these epi data sets and epi questions in here primarily because it's malaria. That's an epidemiological issue. And most ministries of health will focus on the number of cases going up or going down. The people will focus on the disease, on the epidemiology. So I have these questions and I'm asking you to relate them in both directions. What epidemiological data will help explain them, and also how the epi data will help you figure out where, when, why, how to conduct your entomological data collections and how they both rely on each other. So the data, again, uh, depends on the question being asked, the decision being made, and I know you know this if you're in a Ministry of Health, the level of the health system that's actually making that decision. As a note, just like entomology, there is no single epidemiological data set that will answer every malaria control question. You have to figure out what you need, how you need, and when you need it. So here's an example of an epidemiological data question. The question is, we have malaria at our sites. Where should I target my resources? Where should I put all my money and effort and capacity? And what we want to do is, in this example, is identify transmission hotspots. We want to understand where there's the most malaria, because I
Neil, just tell us when you're back. So, to our audience members, sincere apologies. I know you must find this frustrating. It's a little bit beyond our control. I'm sure Neil will relocate to a different spot tomorrow, but let's just try and bear with it. It's not too bad, hey? 30 seconds or so once in a while, but we can still follow the lectures, so that's fine. Neil, just so you know, we're kind of at the 45-minute mark, so you can stop at any point that's convenient for you.
Okay,
Thank you.
how about, yeah, thank you. And apologize again. How about I stop and I'm going to call the the IT people here and ask them what's happening. So we'll stop for us for 5, 10 minutes and
Yes.
Leo,
Sure.
All
yeah,
right. Thank you, Neil. So we'll stop for 10 minutes and wish you well, but don't get too flustered. It's okay. Yeah. And our audience members, 10-minute break. Get up, walk around, refresh yourselves, and we'll reconvene in 10 minutes. Thank you so much.
thank you for being patient with me.
Thank you, Neil.
Hello, hi. I'm in room 216, and I am doing right now from my room and into
Hello again, everyone. So, just a reminder, please feel free to, if you have any questions or requests for clarifications, pop them in the Q&A box, not the chat box, please. Feel absolutely welcome to pop questions into the Q&A box. So we're going to have another session of roughly 45-minute lecture time, and then we'll have the Q&A session. So all in all, about 1 hour left of this training event for today. Um, the event is being recorded, so I'm going to ask Wulan or Dr. Porn if they can put the link in the chat box, but it'll come up on your screen somewhere. So, but just know that the event is being recorded and you will have access to the full recording. So don't worry about that. Over to you, Neil.
Thank you very much. Hey everyone, I had a quick talk with IT and I hope they solved it. Yeah, anyway, uh, let's hope for the best. So, continuing, uh, as we were looking at epidemiological data. So, when we look at, I think we were on the previous one. Where is malaria occurring and where we should target our resources, why we should do this, and what data we would need. And even though this is from an epidemiological perspective, I'm asking you to think about what entomological data system requirements are there. So, for example, where should we prioritize our resources? This will tell us what interventions are best targeted for what people, what populations, and where. Where should we put these interventions? Uh, so if we look at an epidemiological question, which is who is most at risk, right? Who should the interventions target? Should it be kids? Should it be a specific population? Should it be people in forests, right? We want to identify high-risk groups and people who are contributing more to transmission than other groups. And we would need all this epidemiological data on the left. And as Leo mentioned, we will be sharing all these slides, so you don't have to memorize or take any notes. All these slides will come to you. So what are the entomological data system requirements? How will this function with this EPI set, right? And if you look at that target population, let's say it's adult males, where are they when they're getting more malaria? Are they indoors? Are they outdoors? Are they in forests? And that will tell us, the entomological data set will tell us what intervention might work best there, right, with that target group. So you can see how epidemiological data works with entomological data. When is transmission occurring? For example, the question is, when should we deploy our interventions? So we can look at a whole bunch of epidemiological endpoints, including things like rainfall and climate data, which are metadata, which I will get to in a second. And then we can understand when to implement these interventions from an epidemiological perspective, but the entomological data will tell us what intervention would work best there and when to put it in. Is transmission going up or down, right? Are our current strategies working? Should we adapt our current strategy from an epidemiological perspective, right? We'd want to look at how we are functioning, what the disease is doing. Is it going up? Is it down? What the seasonal trends are? Are we moving towards elimination? So all these things are all understanding our current strategy will tell us all these things. And the data we might need is pretty routine epidemiological data. We can look at historical trends, maybe even prevalence surveys if we're doing malaria indicator surveys, and of course, mortality data if that's needed. And the entomology data that will help with this, you can, I'm sure you can guess what it is. You can look at the mosquito biting rates, mosquito densities. Are they seasonal? Are mosquito populations going up? Are the mosquito populations going up along with the malaria going up? Is there enough Lee Stevensi at my site that's resulting in a huge uptake of malaria? So we can use entomological data sets to work with our epidemiological data sets. Are our interventions having an impact? We can look at this epidemiologically. And of course, you can see how entomological data systems would work with this epidemiological data set, right? Because the interventions will explain why and how it's having an impact, whereas the epidemiology will tell us about the malaria. So here's just a brief sort of a table. So common data sets that we look at, if we're looking at where, who, when, why, is malaria decreasing or increasing? Is it imported or local? Are our interventions working? And these are sort of the epi data sets that work with this and that we could collect that would answer these questions. And you can imagine and you can overlay this with the entomological data that'll help you understand this epidemiological data that we are collecting and trying to understand. I'll give you a second to look at this while I have a sip of water. Yeah. So here are our questions and decisions, the epidemiological data we would need, and you can overlay entomological data sets on top of this. So now besides epi and ento data, we have metadata. Now, metadata is associated data that helps us understand what's happening with our epi and or ento data. So things that help us understand what's happening epidemiologically or entomologically. An easy thing is climate, rainfall, right? Understanding rainfall patterns help us understanding what's happened with malaria because usually, and not always, more rainfall, more mosquitoes, more malaria, right? That's usually, but not always. And other things, other metadata that might help us understand is human behavior, which is essential, right? To me, essential. What are people doing when they are exposed to mosquito bites will tell us a whole lot about the transmission system and what we can do. Housing characteristics, what other interventions are in place, and as well as environment and climate. This tells us why, right? Sorry, why do we collect this? Because these factors influence exposure and the intervention effectiveness and helps us make just a lot better decisions. So here is an example. How are people actually being exposed? We want to understand the gaps in protection. If you remember this Venn diagram, we want to understand who is being exposed, when they're being exposed, why they're being exposed, so we can actually do something about it. So the data we would need here would be the mosquito behavior data, and the metadata is human behavior observations. When are people going to sleep? Are they using bed nets? Are they indoors? Are they outdoors? Right? Is it occupation related? For example, men might be outdoors late at night being exposed to mosquitoes. Or is it just community behavior? Maybe all these men are in bars drinking, or that's where they're getting exposed. And this actually happens. Are they traveling? What are the travel patterns, the mobility patterns, right? For example, an easy example here is that two villages, they have identical mosquito densities, but in village A, uh, people are indoors by 8 p.m. and they go to sleep. And in village B, people stay outdoors until midnight. And I've actually seen this happen. For example, this happened in Panama, where in one village right next to the other village, people went indoors early because they did not have electricity. And in the next village, they stayed outside much later and went to sleep much later. And they were exposed to more malaria outdoors. Uh, so the exposure risk can differ drastically based on human behavior, and that's why I feel it's a really important metadata point to collect. In fact, I always collect human behavior with my vector data now, and when I say vector data and outline it, I always include the human behavior alongside the vector data. I can't pull them apart because that's so important. So here's the example I was talking about in Panama, and we wanted to figure out if bed nets were actually useful. Should the Ministry of Health distribute bed nets? There were no bed nets being distributed by the Ministry of Health, and the metadata we used to actually select our sites, you can see it's in Panama all the way on the right. We looked at a site with more malaria, and right where the pink dot is on the top right. And there were two villages, village A and village B. And on the left axis, we see the proportion of people. One means 100% of the people. And on the y-axis, we have the time of night. The green line is people outdoors. So you can see early in the evening, they're all outdoors at Village A. The blue line is people indoors awake. So you can see people are going indoors, they're awake, and then the number of people awake go down because they're going to sleep. The purple line is people asleep with the bed net. They're asleep under a bed net, and the red line is people asleep without a bed net. So automatically you can look at the human behavior in village A and village B, and you can see it's different. And in the example I just mentioned earlier, you can see in village A, people were going to sleep earlier and were indoors much earlier. And in village B, people were asleep later. They also used a lot less bed nets, but they were, sorry, a lot more bed nets, but they were in later. And what happened was, and what happened was, in Village A, because the mosquitoes were outdoors, and there's another graph to show you this, because the mosquitoes were outdoors, people were not being bitten much by outdoor biting mosquitoes, but the few mosquitoes that were biting indoors were giving people malaria indoors. Whereas in Village B, people were outdoors more, so the large numbers of mosquitoes outdoors were giving them malaria outdoors. So Village B had more malaria than Village A, even though both sides had the same numbers of mosquitoes. The villages were actually right next to each other. I hope that was clear. So let's say if we look at another metadata example and housing type, we want to understand if we want to do anything about house construction. So in the figure on the right, you can see what happens is people are indoors and the smells, which are the little red dots, usually rise up with our carbon dioxide and move through the eaves and escape. Apologies again. I'm just going to try and be as quick as I can be. Uh, so I was saying about how what normally happens in a house, the smells and odors that attract mosquitoes rise up with the carbon dioxide that's warm and escape through the eaves, and the mosquitoes follow that. So the mosquitoes follow this little black dotted line and go in. So does the housing impact malaria risk? And of course, we would want to look at wall construction, the type of roof, are there eaves, is there ventilation, are there window screening? And also, in combination with that, we'd want to understand what the mosquitoes and humans are doing at the same time. So, understanding this metadata point of housing can actually tell us a lot about malaria, right? So, traditional housing with open eaves that allow mosquitoes and mosquitoes to go in and all the smells to go out can help mosquitoes enter houses better. So here, if the question was, should we start helping people modify their houses to becoming mosquito proof? This would be a metadata point we would want to collect. So are the current interventions sufficient? And if we're looking at the gaps in protection with the current interventions, and here's a picture that I like to put out, which is a little baby sleeping not under a bed net. The bed net is up, but the baby's sleeping outside the bed net, which is not a good thing. Human behavior is so important. So if we look at are our current interventions sufficient, there are a whole bunch of data points we can collect based on the intervention. And you can see right here, I have bed nets, IRS, and spatial emanators all listed out. And the data points we'd want to look at each for bed nets is coverage, usage, and the active ingredient, what insecticide is on it. For IRS, we'd want to look at coverage and the insecticide on it. And spatial emanators, you'd look at the coverage and usage, amongst other points as well. We want to look at the age of the intervention as well as intervention quality. And an easy example is bed nets, right? Bed nets are supposed to last for 3 years. I'm pretty sure everyone realizes they do not last for 3 years. So in year one of bed net distribution, they work much better if people are using it, And year two, they work less well, and year three, they work even less well. So how old is the intervention? Is my intervention functioning as well as it should? And understanding that is a combination of what intervention it is, how it's functioning, how humans interact with the intervention, how humans function with the mosquitoes where they overlap, and what the local mosquito behaviors are. So understanding all this metadata in combination with the epi and ento helps us understanding what the gaps in protection are related to that specific intervention in place. That was a lot on one slide. I hope that was okay. So here we go. What role does the environment play? Climate, weather, rainfall, right? Here is a graph on the right that's a publication that looks at the impact of humidity, rainfall, and temperature on malaria. So the red bar graph is the malaria incidence, right? And that's, you can see it's the same between A, B, and C. And A is rainfall. You can see rainfall starts and then malaria goes up, and that's easy to understand why. Then the blue is relative humidity, and temperature is in the green at the bottom. And you can associate all these three things with malaria. And we can use these to understand rainfall starts. Okay, in a couple of weeks, malaria is going to start up again. So now we need to be ready for that. So we can use these metadata points to understand how to function better in terms of getting ready, in terms of intervention preparedness, in terms of when to procure interventions, and so on. An example is just that rainfall patterns would increase larval habitat availability and therefore seasonal transmission. And we can use this to understand when and where interventions should be intensified, or when and where interventions should even be implemented. This slide, what not to collect. So again, on the right, I have just data points we can collect with regards to entomological data points. And what most programs try to collect as much data as they can historically, maybe not your program, but historically. And this includes all these data points on the right, even including sporozoites and climate and socioeconomics at every single site, every single sentinel site. And that's not really useful. All that data, I really wonder how much of all the data that has been collected over the last 50 years actually went to changing decisions, actually went to making better programmatic decisions that protected people. And a useful thing to do would be, based on my capacity, based on what decision I have to make, right? What data should I actually collect? How do I prioritize the data I collect that feeds into my data system to make better decisions? So don't collect anything that you don't absolutely need. I mean, we don't have enough money, we don't have enough time, right? We don't. So focus in on what we actually need. And here's an exercise I thought you all could take home and do yourselves. Uh, if you have a limited budget, right? We have a scenario now where there's increasing malaria cases. We have malaria cases going up, and we have funding to collect only three types of entomological data. I made that up, three types of entomological data. Which data types on the right, 1, 2, 3, 4, 5, 6, 7, 8, what would you prioritize? What data would you collect towards understanding why you have increasing malaria and what you can do about it? And this is just a take-home exercise. This is just something for you to think about, to try and figure out, what should I collect, what should I not collect? And what I usually do is take all these data indicators and list them out and prioritize them. What do I think is most important? Sometimes two indicators function really well together and you need both of them. So I'll put them on the same level, or three indicators, put them on the same level. But prioritizing them will enable you to just figure out exactly what to collect and what not to collect. A lot of times we're like, oh, it would be cool to put in HLCs and CDC light traps. And the second you prioritize them, you're like, wait a second, I don't need the CDC light traps because I'm already getting HLC-based data. So prioritizing these indicators based on the decision you have to make is always super helpful to me. So the key takeaway from this module is that different questions require different data sets. That I think is obvious to you. And no single data point or surveillance system answers every single question. So based on your question, we have our data that we would collect, and this is completely dependent on your question and your decision you're trying to make, right? And that data, we could then collect specific targeted data, convert that into information, which I'll get into, and make our decision. And so here's an example from Panama that I went through earlier. We worked at this site on the right. What happened was we used the epi data to select the site, and the entomological data indicated, just as an example, this is site A. This is the number of mosquitoes on the left and the hour of collection on the y-axis. The green is outdoors and the red is indoors. You can see most mosquitoes were biting outdoors earlier in the evening. And this is our entomological data. When we looked at human behavior, we found that people were, as I went over this earlier, so I won't go over it again. We looked at people when they were outside, when they were inside, if they were using bed nets, if they weren't using bed nets. So this is metadata, though I collapse it into entomology data all the time. We looked at our human behavior data, then we combined the human behavior data and the entomology data to understand where people were being exposed. And we found that people were being exposed inside in the blue, outside in the green. This is the proportion of exposure, and inside asleep without bed nets in the red. So at the site, even though there were more mosquitoes biting outdoors in HLCs, because people were indoors, not using bed nets, they were being exposed more indoors with those smaller numbers of mosquitoes indoors. And then based on that, we could figure out, hey, maybe we can increase protections indoors by increasing bed net use when people were asleep. When people were indoors, when people were indoors and awake in blue, we could perhaps give them spatial emanators, SR, spatial repellents, or topical repellents. And when they were outdoors, perhaps larval source management or topical repellents or spatial repellents would work. So you can see we went through epi, ento, human behavior, weather data, weather data. We collected at different points of the year, and we found out that people changed their behaviors by the time of year. And what was really interesting is during the rainy season, people were all indoors at both villages, even when they had electricity, because it was raining. You're not going to go out and get wet. So people were indoors, getting exposed indoors. So we could see different behavioral patterns based on the time of the year. So that was really cool to see, actually. I didn't expect to see that big a difference. And when we look at the interventions, we can actually map interventions and how they function to where and when people are exposed. And the Ministry of Health decided to do a bed net distribution, which was actually really effective. It reduced exposure 94%. So this is an example from Panama. And the question was, should we implement bed nets? And they decided to, based on this small study, to implement bed nets, because the data suggested that over almost 50%, almost 50%, not quite, of exposure would be prevented by increasing bed net use. So the answer to that question was that bed nets are appropriate, but not enough. And other interventions might also be needed to address gaps in protection. Because if you look at that, we had gaps of protection outdoors in green and gaps of protection indoors in blue. And that's the end of my second presentation. And while uh, while the internet is still working, I will quickly go on to my third. Again, I apologize for the internet being not so great. I did complain on the 10-minute break, so hopefully that has succeeded in changing something. Okay, this is the third module. I hope you can see this. So the third module is, now that we know what data to collect and We want to actually figure out how to move into a surveillance system. How do we draft all this into an entire system? So how do we translate our decisions and questions into surveillance design? We know the questions, we know the data we need, and now we have to design this entire surveillance system that can actually generate this information that we want. And the surveillance system is in the blue over here, which is based on the indicator, the method we're using. I'm not going to go into specific indicators or methods because that is all outlined in the other APMEN course and is available online. And Leo, to your point earlier on, tomorrow I will put up a slide on the ESPT and the little ESPT. I did not put one up today, but I will start off tomorrow with that.
Excellent. Thank you, Neil.
Yeah. And then we collect data based on the indicator and methods. We analyze that data to make it information which we can actually use, and then we can make our decisions. So there's a surveillance challenge. We cannot measure everything everywhere all the time. And I wish we could, but we can't. We don't have enough time, resources. We just don't have enough anything. We cannot measure everything. So when we figure out our surveillance design that collects our data, we have to make choices. We have to make choices about where, when, how often, how many sites, and which methods to use. And this is sort of outlined on the right, where we look at sampling sites, sampling units, which sampling units we use, as in how many, how often, which method, and how often we go back to those sites. Now, there's a little bit of repetition over here from the ESPT or Ento Surveillance module that the other APMEN supported training, but I hope it's useful. Uh, what makes a good surveillance system, right? That collects all the data we use. A good surveillance system is representative. It is not overly complex. It's sustainable, which means we can continue doing it repeatedly over time, right? It's standardized, and this is so important. It's standardized, right? As in, like, all the data at every collection time point can be related to each other data set because it's all standardized. It's collected in the same manner, has the same definitions. And most importantly, it's actionable. We can make decisions based on it. The data is directed towards changing things, towards a decision. Bad systems are just complex, they're resource intensive, they're difficult to maintain in terms of finances, in terms of capacity. If we can't do it, we should not, like, unless there's a very extenuating circumstance, we should not really be trying to maintain the system. And if it's not linked to decisions. So when we design our surveillance, there are 4 decisions we have to make, 4 criteria. Where should data be collected? When should it be collected? How often should we go back and collect the data, and what methods we should use? Right? That sort of makes sense. Where, when, how often, and what methods. So where, when we're looking at where, choosing our location where we want to collect the data, and things to consider are epidemiology. The first thing is epidemiology. Does our decision or our question depend on the amount of malaria at that place? On the ecology, because each ecological system, the transmission system at these places could be different. Are we looking at representative data or a targeted data set? Accessibility. So even though we might want to collect data from a place that's really far away and hard to reach, is it sustainable, right? If it's not sustainable, we probably don't want to have a Sentinel site there or don't want to collect data there unless it's for a very specific question or reason. Population size is important. Intervention coverage is important because that directly impacts our question or our decision. Sites with high intervention coverage and low intervention coverage will have completely different systems, completely different transmission systems. And of course, available resources. Can you actually afford to go there? And when I say resources, it's not just money, it's in terms of human capacity. Do we have enough people to go there? Do we have enough cars? Do we have enough vehicles? petrol prices have gone up, right, recently because of a certain war. But can we afford to do all this? So all these things have to be factored in where, right? Another key point is, and I find this actually happening a lot, uh, there's a major road, so it's easy to access a site, right? So a lot of times surveillance sites are placed alongside major roads, and transmission alongside major roads or easily accessible sites are not necessarily the same as something 2 kilometers away, right? That's not near that major road. So depending on the question and decision we want to make, we want to have representative sites that represent the entire region. For example, in the picture here, uh, ideally, we would have picked all these blue sites to represent the entire area, but we could not do that because of resources, and we just had to pick 3 of them, if I remember correctly. So we tried to pick sites that represented the entire region surrounding them that we could access, but we didn't pick them all along major roads so that we could actually get representative data. This picture is from Mozambique. So, here's the Mozambique example. I forgot about this slide. So here is the site, and we picked the orange sites, and we used transmission intensity. The data points we used to collect the sites were how much transmission was there, the ecology, could we actually access the site, population size, the intervention coverages, because we wanted different types of intervention coverage, and the available resources we had. And we mapped all these sites out to be representative for the entire greater area, and we chose these sites to move forward with. When? So how often should surveillance occur? I hope this is not too complicated a figure, but there are 3 types of surveillance: continuous, seasonal, or event-driven that we can possibly do to collect our data. So on the little graphs on the right, you can see month 1 to 12, and these are completely made up transmission seasons. So let's say month 6 to 11 is our malaria transmission season. Now, if we want to do continuous surveillance, which means we do this every year and repeat, 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 and we will understand trends, when to expect malaria, what are the drivers of malaria, for example, rainfall. We'd want to do this for resistance monitoring. So we go back to the same site at the same point in time to look at insecticide resistance. And of course, there are multiple options for each. You can go monthly in option 1. You can go every 2 months in option 3, or every 3 months, like in option 3. That's continuous sentinel site-based surveillance. We can do seasonal surveillance, and this is when we probably don't have resources to go every year, and maybe there's just a transmission season and a very dry transmission season where we don't have much transmission, and we can go like every month, every second month during transmission, every month during transmission, or maybe just right in the center of middle of the transmission season. Of course, this is based on when your transmission is, as well as how to prioritize your resources, right? If you don't have enough resources, we might want to do option 2s and just do focused data collection in the middle of the transmission season. And then event-driven transmissions. For example, there might be an outbreak, or all of a sudden, and I just put this little outbreak star in month 2, 3, and 4. There might be an outbreak and we don't know why it is. So that might precipitate a need to understand where transmission is happening, and we need to do surveillance at that point in time in that location. And we might be able to answer things like, oh, there's an Anopheles stevensii there, or bed nets have completely failed at that site, right? We don't know. So we would want to do surveillance to understand things like outbreaks. So how often should we go back, right? How much surveillance is enough? And this is a question I get so often. And honestly, to me, it's a really difficult question because there is no answer. I can say that the more sites you have, the better the data. The more the data you have, the better the data. But, right, there costs more, there's staff involved, staff costs, and logistically, it's just much more difficult. So in option 1, 2, and 3, each one of them is going to cost way more, require way more people, require way more effort. Obviously, option one is better, right? But how much should we actually collect? And in addition to that, every time we go to the site, we can collect for 1 day or a week. And each one of those will give us much better data each time. But how much is enough? And that's difficult to answer. What we want to do is to collect enough data to support the decisions, right? We do not need to collect enough data to support a PhD thesis. And by that, I mean, we don't need to necessarily collect statistically valid data. So for example, everyone who's doing your PhDs, close your ears right now. Uh, PhDs are academic exercises, right? We need statistical significance. We need all these academic endpoints to make sure we have really good data and analysis. For Ministry of Health, we need representative data. We need data that tells enough data to give us a direction to move in. We don't necessarily need statistical evidence. And sometimes this data is actually super important, like this representative data that may not have statistical significance. So how much data do we actually need? And this is a graph that's actually based on real data, and I'll explain it quickly. So what we did is we went to many, many houses and collected ento data from a site, the number of mosquitoes per house. And then we did a modeling exercise. What we did is we took data from one house and we found the number of mosquitoes and we plotted it on the y-axis. So, for example, this house had 16 mosquitoes, this had 14, this had none. And then we took two houses and we averaged the number of mosquitoes. And that would be over here. Then we did 3 houses and 4 houses and 5 houses and 50 houses, the mean, 100 houses, the mean. And so we could now see the more houses we get, the tighter the averages, the tighter the means are because it averages out, right? So with 200 houses, we could see approximately we have 11, is this 11, 10, 11, 11.5 mosquitoes per house. And this is really good data, right? So it's probably statistically valid to do 200 houses, 11.5 mosquitoes per house. And we can relate that to anything. I mean, any future decision. But if we just do one house, very randomly, you could get 16 mosquitoes, which is 1.5 times the amount, or 0 mosquitoes, and you'll think there are no mosquitoes. So depending on the single house you collect mosquitoes from, that would not be enough to tell you the actual number, which is about 11.5. So you can see now, again, I'm not making up a decision for you. I'm just asking you to understand this conceptually. So the more houses, the better. But however, if we are looking at representative data, where should we stop along this line? And please note, this is data that is from a site, but do not relate this data to your site. Do not think that 50 houses is enough or 100 houses is enough. You have to look at your own data. That's an important caveat to this graph. So perhaps if I were to understand what to use just from this figure and this site, I might look at 50 houses because there's a pretty tight range. But if it were just to be an operational decision and I want to find out the number of mosquitoes per house to understand the biting intensity, right? Maybe just 25 would be enough, or even somewhere around here. But I probably don't want one because the difference between, let's say, 13 and 10 is not that much, right? 13 mosquitoes biting per night or at an operational decision. So I might just stop there. But that's based on just this figure. And I hope that sort of makes sense. More sampling is better because it's more accurate, right? But operational studies want representative data. How do we maximize our data quality with our limited funds, right? So that we can make better evidence-based decision making. So here's an example of how much we need to sample. Let's say we want to look at species composition, and all these mosquitoes I think there are nine, 1, 2, 3, 4, 5, 6, 7, 8, 9, were collected from one site in Mozambique, right? We found 131 Anopheles finescens over one transmission season. I forgot to say that. So these are the mosquito species we got at that site. So let's say statistically, we want to find, then the question is, species the next year, I would have to sample 4,750 mosquitoes, which is a lot, which is more mosquitoes than I got the previous year. And that is to ensure that I get at least one mosquito of each species the following year, if everything remains the same, right? So if that's my question, all of a sudden now I have to do a lot more sampling. However, if my question limits itself to the primary vectors, right? How much do I have to sample to at least see if my primary vectors are still there? To sample my primary vectors, I just have to do about 40 mosquitoes, and I should get my all three primary vectors, at least one of all three primary vectors. So my question is, are my primary vectors still at the site? I just have to sample 40 mosquitoes, which is not bad at all, which is easily done. So we can actually determine our sampling efforts based on our question or our decision we have to make. Another way of looking at this is looking at the same figure. Now just ignore the axes and imagine like this is, let's say, our malaria data. I'm imagining the amount of malaria by house or something like that. So let's say this is our baseline. And now we implement an intervention. And with our intervention, malaria goes down, the mosquitoes numbers goes down. And now I think I phrased this wrong. Imagine this is the number of mosquitoes again. Apologies. And now imagine that we have, without the intervention, then we put the intervention in and we expect the mosquito numbers to go down, right? And that's what you see, the lighter gray. I just duplicated this figure, actually. It's fake data. So we expect everything to go down, the number of mosquitoes per house to go down. Now, if you look at this, if we sample just one house right here, we won't see a difference from year to year. So we won't know if our intervention made any difference. So we'd probably want to come to somewhere out here, right? And do a number of houses in this figure, it's 50, 60 perhaps, 60 households, and you can get a separation between the years. I hope that made sense. So depending on your question, you might want to figure out how much sampling you want to do over here and to this site. So what is your question and what is your decision can tell you how much sampling to actually do at your site to answer your question and make a decision. So this all boils down to precision versus practicality. On the right, we have a whole bunch of examples, which was pretty cool. When it's highly accurate and highly precise, and this would be your academic studies, everything is almost perfect. Your end data points are right at the end, right? They're perfect. High accuracy, low precision, or lesser precision, they're around the bullet. Low accuracy, low precision, which we probably don't want so much, and low accuracy, high precision, we probably don't want that. So the top right is probably academic studies, and the top left would look at representative data and how we would collect data with less sampling effort. So in the perfect world, we have a whole bunch of villages, monthly collections, and multiple methods. But in the real world, everything is limited, right? So the question is, what is the simplest surveillance system? Still answers the question. And for every question and for every site, it will be different. So how much evidence is enough for a decision, right? So operational decisions are usually made, and this is a caveat to everything, right? To academic research. Operational decision perfect evidence, right? So it is our job to predict data, which is the high accuracy, lesser precision, is often more valuable than perfect data that is collected too late. So how do we build our surveillance system around decisions? So here are two examples. On the left is, should we implement IRS or not? That is a decision, right? And the question is, should IRS be implemented in a specific area? And the possible surveillance requirements are species composition, so we understand what species are there. Species-specific resting behaviors, so we understand which species is resting indoors on walls. And of course, it's the resistance. Are they susceptible to the IRS chemical? And this way we can figure out the proportion of species that will actually be impacted by IRS. And on the right, it's a similar question. Should we continue IRS or change the active ingredient, or change to bed nets, or change to spatial laminators? And the question is residual transmission occurring with IRS? Now, please note that one of the first question is, should we implement IRS? And the second question is, continue IRS. And you would imagine that they're both very similar, but they're actually very different population. And the second question asks us, is IRS impacting behavior, human behavior intervention coverage? Because that will tell us how much continued exposure to your indoor behavior, and you find mosquitoes resting on walls, you don't know if you resting on walls on the left, you behaviors and they're outdoors, you don't know that. Or if you've completely killed all that species off, you don't understand it is the continued transmission that's happening. Continued exposure. And you'd understand that by looking at where systems actually look different than with each question. I hope that made sense. I know we logged off in the middle of it, but I hope the explanation came through. So what does a success look like? What does a successful surveillance system look like, right? So many people think or even define it as, oh, we collected a bunch of data. We were successful in collecting data. And I would ask you to redefine this from the beginning to look at real success being evidence-based decision making. Did the data I collect result in better decision making? That is what success would look like. Right. So, successful. Apologies again. Believe me when I say I am really frustrated with this internet. Apologies. Uh, where was I? Yeah, too many sites. So imagine you can collect at 10 sites, But 8 of those sites are basically the same, and the data you get from those 8 sites reflects each site. So you can technically collect just from one site and relate the data to all those 8 sites. So if you collected too many sites, you might be wasting your operational evaluation, right? Insufficient standardization. So if you have collecting the same types of data in different ways, or at each site you collect different types of data to answer the same question, your analysis, your data designed to answer questions or use your data, you're wasting data, and that's a mistake as well. And if you just collect data because it has always been collected, I see this a lot. We've been collecting this type of data for the last 20 years, so we should continue collecting this kind of data. I think that's a waste of time and effort. And I hope you do too. And I hope you can refine what you collect to reflect actual decision making. Oh, sorry, I had little little animations. Too many sites. Imagine collecting at every single one of those houses at the same site. That's insufficient standardization, which be on the left, which is a mess. And that's no plan for data use is basically throwing your data in the garbage. And of course, collecting data, every single type of data, because it has always been collected. So here's an exercise for you to think about. Uh, Imagine your district has high bed net coverage. It has continued persistent malaria, and you have a very limited budget. So I'm asking you to sort of design an entomological surveillance system, right? To answer the question, like, what's happening over here? What can we actually do to reduce malaria? So where would you sample? Now, you know your district better than me. So just think about it from your district perspective. Where would you sample to get representative data? How often would you sample throughout the year to be able to get the data you need to represent maybe the different seasons, maybe just the transmission season? How often would you go back each time you visited that site? What methods would you use to collect the data that would answer this? Why, with still high bednet coverage, we have persistent malaria? And then downstream, and we'll get through this in the next presentation, how would you analyze the data, right? What I always do is before I start a study or implement anything, I try and imagine every option of data that I might get. When I analyze the data, what the results might be. I try and analyze and not analyze, I try and figure out every option. Maybe there's high indoor biting, outdoor biting, people are here, people are doing that. This intervention is not working well. I try and look at every option of things that might happen and base the data collection on that. What are our decision options? So once we know every single option that might happen, we can actually imagine before we even collect the data, what decisions to make so we can actually prepare ourselves. And what is the best decision? What is the best decision, of course, will depend on the data that you collect. And based on all this, what is the core set of information that you would need to answer these questions? So working backwards from that best decision, right? What decision you need to make? Work backwards and try and understand my district has a lot of bed nets, high bed net coverage, high bed net usage, but still has a lot of malaria. What entomological data system do I have to develop for this site? Right? So that's an exercise for you to do for yourself, for your sites that you would want to look at. So again, repeatedly, surveillance systems should be designed for decisions and not necessarily data collection, right? Just because you collect a lot of data doesn't mean it is a good system, right? And the one that provides the information required to make better vector control decisions is actually a better data system. So the take home from this module is that operational decisions are usually made using the best available evidence, not the perfect data set, not the PhD thesis data set. Representative data are often more valuable than perfect data collected too late. So I hope that's a take home that that you remember. And that's the end of that presentation for now.
And
Uh,
I think we should cut it there if that's convenient for
oh,
you, Neil.
yes, it is.
It is. Okay,
Yeah.
so we've used up our allotted time for
I'm
today.
sorry.
No, that's fine. Had you intended continuing, Neil?
No, I'm
Okay.
actually done. Yeah.
So bang on, spot on. Very good timing. Thank you, Neil. So I'm sure I'm echoing what our audience members also feel in terms of just listening to you. One cannot help but get the loud and clear message. Here is a person who has very deep understanding of entomological issues and epidemiological issues in the malaria world, the real world out there with deep experience and understanding and a wonderful ability to convey and share that experience for the rest of us. So, Neil, again, from all of us, a deep, sincere thank you for setting aside time to share your knowledge and experience with us. A huge, very valuable set of information that you've shared with us. Thank you for that. So, audience members, we have time now for a few minutes of Q&A. So let's dive into Neil. I've gleaned some. Quite a number of the questions were put in the Q&A box, and you dealt with the issues that were questions subsequent in your lecture. So you actually answered it after the questions were posed. So I missed out, I skipped those. I'm going to see if I can share screen here.
And while you're sharing the screen, Leo,
Yeah.
I saw a couple of comments where people asked for the presentations. All the presentations will be shared through APMEN. And please note that you can use these presentations for anything you want, for any of your presentations. If you do any trainings or anything, you do not have to ask me for permission or anything. You can go ahead and use them.
It's very generous of you. Very valuable opportunity here for people to share with colleagues in their respective programs or academic departments and so on. So thank you for that offer, Neil. So I'm going to jump in with the first of the few questions I have. This is from Gideon Johannes. You always ask very pertinent, very good questions, Gideon. I'm in Bioko Island. We have been collecting mosquitoes by human landing catch, CDC, light traps, and Procopac. While we collect an overwhelming number of mosquitoes by human landing catch, we collect almost zero mosquitoes by Procopac. For us to understand resting behavior of mosquitoes, we thought that Procopac would be the best method. However, we are not collecting mosquitoes by Procopac, irrespective of getting plenty of mosquitoes indoors and outdoors by human landing catch. How can we get then the accurate information about the resting behavior of mosquitoes as we are spraying insecticide for controlling mosquitoes? I think he just wants the reassurance.
Yeah.
Uh, yeah, okay, over to you, Neil. Thank you.
Yeah, well, really good question. So my first question would be, where you look doing the Procopac aspirations in sprayed or unsprayed houses. If they were unsprayed houses, then you got your data. The Procopac is a good way of collecting indoor resting mosquitoes, uh, and they're probably not resting indoors. It's as simple as that. If you were looking at sprayed houses, now this is complicated because we don't know what the answer is. If you weren't collecting many, it could mean that your IRS is working in those sprayed houses and killing the mosquitoes, or mosquitoes have changed their behavior. And please note that if you have been doing IRS there for a while, the mosquitoes might have changed their behavior. And there are many sites now where mosquitoes actually will fly indoors bite people and fly straight outdoors because if they rest on the walls, they die. So they have changed their behaviors. If you are doing your the last point to answer this question would be if you're doing your Procopack collections happening throughout the night, because sometimes mosquitoes fly in, will rest on the walls for an hour or two and then leave. And if you go only in the morning, you will miss all the mosquitoes that rested throughout the night. But then again, they might not be resting based on how you're collecting the data. I hope that that answered your question. It looks like you're doing a good job and your mosquitoes might not
Yeah,
be resting indoors. So
spot on.
IRS might not be that active. Yeah.
You're doing the right thing, Gideon. Pray continue. Um,
Yeah.
so the next question, thank you, Neil, is from Dr. Arun Chauhan. When should we do insecticide resistance monitoring in a particular intervention area? And I'm assuming it's double, once per annum or how frequently? And when should it be
Yeah.
pre-peak transmission or post-peak transmission? You answer, Neil.
Yeah. So I think WHO recommends once per year. But when, as in what point in the year, is I would focus on the primary vectors. When are the peak populations of your primary vectors? And I would then try and sample them because those are the mosquitoes that are giving everyone the disease. And during that peak populations, the insecticide resistance study population of vectors that is giving people malaria. So you can make the best decision based on your primary vectors.
Thank you, Neil. Third question regarding the test question about seasonal case upsurges and allocating surveillance resources with limited funds. Would intensifying surveillance around the upsurge period while easing up on year-round surveillance not skew data for decision-making in future years? Is it not better to have a more consistent surveillance data set over time?
Resources, I would focus on the direct question we want to make. So if you have a really intense transmission season and the rest of the year there's almost nothing happening, I would focus on your transmission season. But if you have medium transmission happening throughout the year and really high transmission happening in a couple of months, I would focus my transmission on those high transmission, focus my collections on the high transmission months, but get representative data. Maybe do one or two collections of the rest of the months, of course, depending on your resources. So that way you maintain the consistent surveillance data set that you talk about, which is actually quite important and quite nice to have. Yeah.
Thank you, Neil.
Oh, and Leo, please feel free to interject because you are really good at all this as well. So feel free to answer questions, and uh, I would be happy if you did.
Thank you, Neil. Thank you. So next one, as per your kind field experience and considering the limited financial resources available, what category of human resources should be engaged or hired to collect data on the minimum essential entomological indicators required for the malaria control program at provincial level? This question has me very worried because it kind of implies that okay, we need some entomological information, so let's just contract in a group of people, do some basic training, put them out in the field for a couple of months, and then we fire them, and next year we hire. Could you just say something about the need or benefit and how essential it is to have a dedicated entomology team that is well trained and well
Yeah.
capacitated in terms of equipment? It's not just bringing in a small team of temporary workers. Just if you can say something about that, Neil.
No, thank you. You got it, Leo. So it's really important to maintain the entomological capacity in a program, and this can be a core set of people with the experience and knowledge, depending on the resources. A core set that can train people consistently. Who, in the perfect world, we'd have people who stayed with the program for years and years, and we'd have enough trained people. But I would focus on a core set of people that can train us in case more when needed, and have expertise to maintain standardization and maintain surveillance data sets over time are conducted by well-experienced people over time. I hope that made sense.
Yeah, no, thanks, Neil. We lost you there again for about half a minute, but I think your core message did get through. So thank you for that. Here's a few people asked questions around this basic theme. Can you elaborate a little bit which variables are included when you're collecting human behavior in addition to your vector data? What are
Perfect.
the uh, key social behavior parameters that you would focus on, Neil?
Perfect. This is a really good question. And this is covered in detail in the other AppMen training. However, what I will do is put together a slide set and data sheet, collection sheets, etc., and an analysis sheet, and include that in the package that AppMen will share. But the core set of data is why do we do this, right? And from the human perspective, it is what people are doing and when they're doing it, when they're exposed and when they're not exposed, when we can protect them and when we cannot protect them. And so the data points I usually collect are they inside or outside? And that'll tell you if you can use indoor interventions or you cannot use indoor interventions outside. Are they awake or are they asleep at both the sites? Because if they're awake, you can't use bed nets, right? But if they're asleep, are they using a bed net or not? And if they're using a bed net, that's great, they're protected. And if they are not using a bed net, we can get them to use bed nets, hopefully. But maybe another intervention might work better. So the data points, the minimal amount of data points I would collect are they indoors, awake, or asleep with or without bed nets? Are they outdoors, awake, or asleep with or without bed nets? And that's collected every hour of the night.
Thank you, Neil. So last question, uh, because many of the other questions were covered already in subsequent lectures on your part, post the question being posted. And I think this is also one that I extracted before you actually reached the explanation. What are the factors to be considered to get representative data? I think,
I wish I understood the answer to this well enough. I would, as I mentioned earlier, the more data, more data points, the better. However, I would maximize the data collection I can do to answer the question. So focus in on the data points that you need to collect to make the decision, and then maximize the data collection from an operational point of view. So as many sites as you can do, as not as many sites, but as many data points as you can collect based on your question. That's what I would do. And if you actually attend the other AppMen training, we go over this in a lot more detail. Yeah. And if you can actually download all those files from online, correct, Leo? Are they all still available online from the last training?
Yes,
yes,
they're available. I'll
Perfect.
share the
absolutely.
Yeah.
link.
Yeah, please. You can download all those files. And again, feel free to use them and message me questions or
Yeah.
anything.
Thank you, Wulan. It would be great if you
Yeah.
could share those links. Thank you for that. So Neil, there are some late questions coming through, and this isn't strictly on the theme, but I think there's so much talk going on. It's so pertinent. Please, Prof, can you talk a little bit about recent WHO recommended spatial emanators and their applicability? 1 minute, Neil, just in summary.
1 minute. For spatial amnesias. Okay, I work a lot with
Figuratively,
spatial amnesias,
figuratively.
so I will try and talk fast. Spatial yeah. Spatial amnesias function by producing a volatile chemical in the air that repels, kills, knocks down mosquitoes. It does protect against malaria a lot. There have been several studies that have demonstrated that. WHO has recommended spatial amnesias as a supplement or complement to bed nets, so that we'd want them to use them with the bed net. At present, I believe they work by themselves as well, indoors and outdoors. They protect people to a certain extent, but we don't know to what extent because we don't have that data. WHO has recommended spatial amnesias, and right now there's only one product, which is Guardian from SC Johnson, that is available and PQ approved. But there are other spatial amnesias products that are not PQ approved yet that are available and coming up the pipeline. There's a Kincho product, there is a Wider Brothers product. But right now, the one that is WHO approved, if you need global fund funds, if you have global fund funds, you'd want to use the Guardian product, and you'd have to contact SC Johnson about acquiring it. Yeah. They work really well. I carry them everywhere with me. In fact, I'm in the field this month and next month, and I'm carrying spatial amnesias with me.
Yeah, thanks,
Yeah,
Neil.
I hope that
So,
answered the question.
I mean, this is a course in itself, the whole issue of spatial emanators, and a very
Yeah.
important topic it is too. But just for clarity, correct
Mhm.
me if I'm wrong, please, Neil. Just so that people understand and know, WHO only recommends spatial emanators for indoor use, and if my understanding is correct, in combination with either IRS or ITNs, and then only for two specific products, both by Johnson. So, but they work very well. The evidence is overwhelming. They work very well, and there are a number of different experimental trials going on to try and get the relevant data on outdoor applicability. And a lot of us are looking forward to that information becoming available. From all of us, Neil, deep, sincere thank you again for wonderful set of lectures this afternoon. We look forward to continuing the lessons tomorrow. Thank you for your patience. Thank you to our audience for your patience with the small minor hiccups in internet connectivity that Neil experienced. I'm sure none of us got too upset about that. It's minor. Fingers crossed tomorrow the weather will be better and internet will be better as well. But to our audience, thank you so much for being with us. Good numbers, strong numbers, well over 700 of you attending. And we look forward to you participating again tomorrow. I'd like to thank Wulan and Dr. Porn for being in the back room, making sure that everything, the Zoom platform is working well, information is being shared, etc. Thank you, Wulan and Dr. Porn. And Dr. Mukhtar, if you're still with us, thank you for your presence, opening up the course for us. And to all of you, see you tomorrow. Thank you. Bye-bye, everyone. Thank you.